Dr. Bill Canfield is recognized as a world leader in glycobiology, the science of understanding and manipulating carbohydrate structures. He was fascinated with research into Pompe disease.
I went to medical school and graduate school at the University of Washington, where I got my MD and I got a PhD in molecular biology. I did medical residency training in internal medicine and fellowship training in genetics, and then went to Washington University in St. Louis, where I trained in hematology and oncology and became interested in storage diseases or lysosomal enzyme deficiencies. This is a group of about 50 diseases where the body is missing an enzyme due to genetic deficiency. And because of that missing enzyme, a chemical product in the body builds up until it causes disease. In the case of Pompe disease, glycogen, which is a polymer of glucose, is what accumulates, and it accumulates in the muscle cells. They suffer from either a defect of the skeletal muscles. The skeletal muscles become weak. It's a form of muscular dystrophy, different than the most common forms of muscular dystrophy. And they can also develop and die of heart failure due to the failure of the heart muscle to function properly. There are both infantile, juvenile, and adult forms of the disease. In the infantile form, the babies may get sick as early as a month of age, and they tend to die before their first birthday. Adults can have the disease for many years and be increasingly impaired, a walker to a wheelchair to a ventilator perhaps, and maybe over a course of 10 years or so become increasingly disabled by the disease.
Dr. Canfield began a new company called Novozyme and hired John Crowley as CEO in 1999.
John was obviously the parent of two children with Pompe disease, and he also was the head of the Children's Pompe Foundation, which was a small nonprofit that he and Eileen had established.
Novozyme has always been a science-driven, patient-focused company. From its beginning, when Bill Canfield started the company in mid-1999, till today, we have always had the patient at the center of everything we do at Novozyme. And now we're at a very important period and very exciting period in our history as we begin to take our technologies and our drugs through preclinical development and into the clinic to treat patients beginning with Pompe disease and then on to other lysosomal storage diseases and many other diseases where our glycobiology expertise could deliver life-saving therapy to thousands of patients worldwide.
The movie Extraordinary Measures has brought a lot of attention to a disease few people knew even existed.
Some of the differences in the movie as far as I understand, is the Harrison Ford character is portrayed as quite a renegade who breaks all the rules and is really unqualified and untrained for what he's doing, and kind of comes out of left field with this great treatment. And that's not reality. This is a field where people train for many years. I trained for 19 years to prepare for this career. The actual drug development of Myozyme, the Genzyme treatment for Pompe disease, required literally hundreds of scientists and business people and many millions of dollars to get the drug approved. Would not have been approved without the assistance of all the patients in the clinical trials and the FDA. So, this is really a team sport, not an individual sport. Virtually everyone working on the project had spent many years in training to be prepared to carry out their role. So the currently approved drug from Genzyme is called Myozyme, and that's a recombinant form of the missing enzyme in the patients. They receive injections, intravenous infusions of the enzyme every 2 weeks. And some of the enzyme goes to the muscle cells, it goes to the heart cells as well, and enzymatically removes the glycogen that is built up there and causes the problem.
Novozyme, the company Dr. Canfield founded, was acquired by Genzyme in 2001. The research into finding a cure for Pompe disease continues on a second-generation drug that will continue to improve the quality of patients' lives.
The ability to come up with something that's completely new that didn't exist before. I mean, 10 years ago, Pompe disease was an untreatable fatal disorder, and that's just not the case anymore. And you know, having had a small part in that is immensely satisfying.